So we have with us today Dr. Polsky.
Good morning, gentlemen.
Morning.
Morning. Nice tie.
Memorial Day.
Yeah.
Yeah.
Our slides are up. All right. So we'll jump right in. As you mentioned, I'm going to fuse the COVID discussion at the end of this. I don't think we need to adjourn from Board of Health. I think we can do it all together. So as typical in the spring, I always bring up where we rank with national and state county rankings. So each April, the Robert Wood Johnson Foundation comes out with rankings, and we have been doing progressively better over the last several years. So they rank in two different ways. This ranking is in what they refer to as health factors. Those are things like smoking, obesity rates, sexually transmitted infections, teen pregnancies, access to health care. And across the state, we rank fourth best. And then they have another ranking referred to as health outcomes, and that is life expectancy, low birth weight babies, and then subjective factors, how people self-rate their physical health and how they self-rate their mental health. And we are in the top 5 of those as well. I will say that when it comes to health, when we are mentioned in the same shading as Montgomery County and Howard County, we are doing really well. I mentioned those two because they're the only 2 counties in the state to have smoking rates less than 10%, something that certainly we aspire to here. And one of the reasons that we continue to move up in the health rankings across the state is that our smoking rates continue to go down and down. So when I started 8 years ago, smoking rate across the county was about 24%. This latest year it's down to 15%, which is tremendous. It means for every 3 smokers we had in the county before, we're now down to 2. The only concerning sort of out there on the horizon is that, as we all know, vaping rates among teens is very high. Now these are pre-COVID stats. There are a lot of health stats that are kind of on hold for 2020 because the people who usually come out and generate those stats are kind of busy with COVID at the moment. And we really don't know. It's one of the things I'm interested in. As kids were physically kept apart during this last school year, what impact, if any, did that have on things like vaping and teen pregnancies and a few other things? All right, one of our usual transition slides. So tidalscape here in Southern Maryland. And so next I'm going to transition to overdose deaths because, as I'm sure you're all aware, in the midst of the pandemic, both statewide and nationally, overdose deaths increased yet again. Statewide, this last year, overdose deaths increased by about 18% to an all-time high. Calvert was one of only 4 counties in the state that had a decrease in overdose deaths in 2020. And when you look over the last 3 years, because we never like to just single out one small piece of time, you look at the last 3 years statewide, overdose deaths have risen about 23-24%. In Calvert County, overdose deaths have dropped 26%. And currently, if you take a look per capita, overdose deaths are 40% lower in Calvert County than they are statewide.
It's amazing that this still happens. This is not new. You know, I mean, you could see it being removed from a generation, how the 70s had all the opiates and stuff. And you could see, okay, maybe there was an ignorance, but there has not been an outlet, media outlet, print, anything that has not talked about the dangers of this stuff and how it continues to happen. It is mind-blowing.
And that just speaks to how poorly we understand the drive for addiction and our very limited abilities, once somebody does have addiction, to be able to help correct that and move them back in a better direction. And I know we're time limited, so I'm not going to get into all the different factors, but I do want to just touch on 2 programs that I think are certainly part of what is moving us forward in this. One is the collective program, the Rational Reentry program, that helps people who are have been arrested, are now in the judicial system. We know that about 80% of inmates at our local detention center have treatable behavioral health needs, and this has certainly been a collective effort, and you see all the different symbols from the different county agencies, private agencies that have come together to try to help, and this has certainly made a huge difference. These are not only providing services, screening and treatment services in the detention center, but very, very importantly, bridging those services when people are released. And we see with shorter and shorter sentences that need to bridge people out back into the community is really critical. And then as part of this, is the newer program that we have at the health department with the mobile crisis team. And this has been building over the past 2 years. So this is a team that responds along with EMS, along with the sheriff's office or state police to an overdose. They arrive on scene. As long as that person is medically stable, then our team takes over. So the EMTs that you see down in the bottom right, once they know that things are stable, they can move on. And so I think one of the important things to drive home is that prior to our team being out there, that the EMS team then needed to transport that person to the hospital. That was more time that ambulance crew was taken away. There was more paperwork involved. Now, once the person stabilized, our team takes over. That ambulance crew is now freed up if somebody has a heart attack, if somebody has a stroke. So everyone in the community benefits from these types of collective efforts. And then just wanted to highlight, this is a comment from Corporal Moran, who is with the Sheriff's Office on the Special Operations Team. And I'm going to quote what he said. Mobile Crisis Team responded to an incident in Dunkirk per my request for an adult female having a schizophrenic episode. The Mobile Crisis Team was able to convince her to go to the hospital for an emergency evaluation in the MCT van. This prevented what would have most likely been a hands-on, forced emergency petition by deputies after the patient had stated several times that she did not want to go to the hospital. The Mobile Crisis Team was able to work through her delusions and convince her that an evaluation was in everyone's best interest. So again, speaking to, this is not just isolated to people struggling with recovery, that there are spillover effects that directly or indirectly impact all of us. And the last thing that we need is to have law enforcement getting involved in areas that they don't need to and inciting problems. So again, I get back to this has just been a tremendous collective effort across the county to deal with this problem. In 2021, so far, our overdose numbers are stable with 2020. We hope that we'll see that start to shift further down. And then just quickly, because Lyme disease is an ongoing problem, and as I remind everybody at my health department, we are not a COVID department, we are a public health department. So the potential for transmission in Calvert in 2018, there were 103 cases in Calvert County. That dropped down to 49 in 2019, but that's still twice as high per capita as across the state. And this shouldn't be we may never get to equal. I mean, if you live in Baltimore City or in Rockville, your chances of getting Lyme disease is close to zero. But we know that education goes a long way. This is an almost 100% preventable illness. So I've showed this slide before, but I bring it up again because I think it's so important every spring to remind people as they and their children are out potentially getting exposed to ticks, that if either you or your child is bitten by a tick, if you remove the tick within the first 24 hours, the potential for Lyme disease is zero. And that really speaks to the importance, especially for those with children, every evening or pick a time of day that you're going to, as long as they're outside playing, which we want them to be outside and playing, give them a good check to make sure there's no ticks. If you see one and you remove it within the first 24 hours, then there is no risk. And about 36 hours is where that risk really comes in. And then by the time you get to 72 or 3 to 4 days after, you see the risk of transmission is getting close to 100% at that point.
So, Doc, you hear both ways. If you don't get the head out, it doesn't count. I've heard if you just get it. What's the truth on that?
Well, you certainly would like to get the entire tick off. And we talked a year or two ago, I brought in a little device that it makes it almost impossible to leave the head behind, which is a little plastic device that we buy in pet stores that is really meant for dogs and cats, but works great for people as well. It's just a little plastic thing that costs $1. But if the head gets left behind, no, there's no further risk of Lyme transmission, but the problem is that that's a setup for bacterial infections that are on the skin because you've got a foreign body there. So you do want to try to get the entire tick off. If the head is left behind, just very carefully with tweezers, just try to go ahead and get the rest off.
But the number one thing here, get him out.
Correct. And if you discover, because the nymphs on deer ticks are so small, every once in a while, somebody's going to miss that. So if you do discover a bloated tick, if a tick is bloated, it's been there for more than 36 hours. But the key there, and again, we've mentioned in the past, that there is a prophylactic dose, a single dose of antibiotic that is basically 100% preventative of people getting Lyme disease. So if somebody does find a bloated tick on them, remove it as soon as you see it. and then call your doctor or your nurse practitioner. If it's middle of the night, you can wait till the next morning, but call them within that 24 hours. And you actually have 72 hours to take the antibiotic once the tick is removed, and that treatment is incredibly effective. It's the same antibiotic that you would otherwise need to take for 2 whole weeks if you waited and actually developed Lyme disease, but it's just a single dose if you catch it early, and it's actually more effective if you catch it early than you wait for the whole 2-week treatment. Children below age 8 are not eligible for that treatment because there's a potential toxicity for kids, which again makes it even more important to really thoroughly check children.
Doctor, the public notice for this in our Parks and Recreation area?
We have in the past. I'll make sure that we
That's a
have
good
something
call.
up now.
Yeah.
Yeah, because the sign that we have right there on this slide, we would post in certain areas around. And I'll also remind people again, prevention is what we always strive for, not waiting for a problem to happen. So if you have leaves or debris in your yard, remove that. And a lot of studies have shown that over 50% reduction in Lyme cases around the house by just getting rid of debris that sits around, because it's a perfect place for both the ticks and the animals that ticks live on, because they don't just live on humans, to get them out. And then for personal protection, DEET, which is actually safe at any age, say less than 2 months, you shouldn't use it, but it's unlikely you're going to have a 1-month-old out in a place that would be exposed. And then oil of lemon eucalyptus, that should not be used in children below age 3, but otherwise it's very safe. And permethrin is the spray for clothing and for shoes or boots. It is not meant to put directly on the skin. A little bit will come in contact with the skin from the clothes, but that's not a real issue. But it is a big skin irritant if you put it right on the skin. And then a little cityscape, and we will transition over to COVID cases. So we're extremely happy that we continue to see the number of cases trending down. So this week, we only saw 57 cases. I will say that puts us back at the level we were in early November, but certainly way lower than we were going back into March, where we were seeing close to 200 cases a week, and our positivity rate is down to 3. I just want to quickly point out, because I know that sort of this feeling is building that maybe we're done with this, that this is not a history lecture. We are still very much in the midst of this, and statewide, I put it in the top right corner, this past week, there were almost 2,500 cases diagnosed statewide. And again, I always say those are the ones that were diagnosed. There are other cases that go undiagnosed. There were 91 deaths across the state this past week. 450 people are currently hospitalized statewide, and over 1,100 emergency room visits this past week. So age distribution, I just want to point out a couple things overall. Clearly things are down in the 75 plus range. You see a little line there because there was only 1 case this week and 1 case the week before. And for the first time in the 66 to 75, there is no 4th bar because there were no cases in people 66 to 75. So people over 65 this past week, we saw a total of 1 case. And again, that should really drive home to people how incredibly effective these vaccines are. That is a population where we've seen the greatest uptake of vaccination and the most dramatic drop in the number of cases. That is not by any means coincidental. The only age groups we saw modest increases were in children and early adolescents and in older teens. And then the big chart, I'm not going to go through this in any detail, but things are kind of status quo as far as where we rank statewide. We're still second highest in terms of the number of seniors, or proportion of seniors vaccinated, and we're still 11th in terms of overall population. And then I put in a few numbers because there was a question last week from Commissioner Hance, specifically about the 12 to 15-year-olds, and then maybe about the 16 to 18-year-olds as well. So we've seen a pretty quick uptake of vaccines. The vaccines have only been available for 12 to 15-year-olds for just a little bit over a week, but already about a quarter of the 12 to 15-year-olds in our county have gotten a first vaccine. We are trying to work with the schools to, the timing was not great for the school year for the 12 to 15-year-olds. We're trying to work out for next week to actually do vaccinations at each of the middle schools, at least to get a first dose in. And then the second dose would be into the summer, and we'll do the best we can. Our parents at that point may need to bring their kids to one of the other sites. And for the 16 to 18-year-olds, we're getting close to half in the county have had at least a first dose. And then you can see again for the 65 plus, we're at 88.9%. And I have the picture of former Commissioner Wilson Perrin up there again, just to mention that in our African American population, and this is great thanks to our local African American leadership here, that vaccination rates in African American seniors are actually 5% higher than vaccination rates in white seniors in our county. That is certainly not typical statewide or nationally.
So maybe this summer at the summer camps, could arrange to do some vaccinations? Gives you an opportunity where you have some congregation of kids.
Absolutely, and we are trying to work with martial arts studios, dance studios, every and any business or organization that the adolescents are part of, or the majority of who they serve, to see if we can work out something either on site or a way to really work with the parents to make sure that the kids have an opportunity to get vaccinated.
Pools, the Cove Point pool, the pool up at the beach.
Yep, absolutely.
You know,
And we now have a van that we're ready to start moving out so that we can hit maybe 2 or 3 places in a day. Because we know the numbers will be relatively small. We're not looking at hundreds of people at a site, but if we can get 25, 50 people vaccinated at a site and then move to someplace else, that would be great.
Because in the summer, people are on vacation, so they're out traveling, and you lose the structure, your
Correct.
normal life structure. So
And not that we want to overlook, because although our hope is that the cases will continue to go down over the summer, I will mention that in March that big increase, at basically tripling to quadrupling of cases in March, was because we had the UK variant showed up. It wasn't that there were more susceptible people. It's just that when you end up with a variant, people who otherwise had dodged the bullet, all of a sudden transmission rates go up. And so it's possible over the summer that a new variant may pop up. So we don't want to overlook that we may see cases pop back up again. But certainly the biggest driver is that before the school year starts, that as many middle school and high schoolers are fully vaccinated as possible. And we sent a letter to parents this previous week that reminding them that if their child is eligible for vaccination and they're not vaccinated, that if one of the students sitting near them comes down with COVID, that the kids around will need to be quarantined for 10 days. And that means that their child is not able to attend school. So, and sports and other types of extracurricular activities. So there's, again, making sure that by July, if not sooner, that adolescents have started their vaccination series, I think is extremely important for everyone.
Doctor, the downrange plan, because this thing is not going to drop off the map on December 31st of this year.
Right.
The downrange plan for sustainment is, there have been discussions with the state health director and CDC as to what that's going to look like.
Well, and so there have been discussions, and this is such an unpredictable problem that we've been dealing with. So one of the questions is ultimately how many people are left unvaccinated, and at that point, are we looking at individuals or households? Because that's where we see the greatest transmission is that once somebody gets it, that almost everyone in their household who's not vaccinated ends up getting infected as well. Or are we going to see the widespread? And unfortunately, and we'll talk about nursing homes in a moment, nursing homes are very well vaccinated at this point. So what that will look like come fall into winter is unclear right now, but there are discussions about this possibility, that possibility, but certainly no plans have been finalized because we don't know what we'll actually need to, at that point, lay out. Certainly, everyone's aware that if we do end up with a variant that evades the initial vaccines, that there will be a need to ramp back up to make sure that supplemental vaccine is available to people as quickly as possible.
With the return to air travel, and it's going up like a rocket. To me, that's going to be a major issue because we'll be right back to the same situation where in the course of 5, 6, 7, 8 hours, you've got someone that traveled from somewhere else in the globe offloaded here and in the population.
Absolutely, and certainly vigilance will be very high. And I think everyone should understand at this point that if in any part of the country all of a sudden their cases start to jump, that almost certainly means that there's a new variant there. That, you don't just have same old, and then just coincidentally you see, this mushrooming of cases. And so there is still additional screening at airports for people coming in. There are testing requirements, or at least testing recommendations for people coming from overseas. And it also speaks to the importance of vaccine getting to other countries as well. That my understanding is that in Canada right now, less than 4%. I mean, we think of third world countries, but Canada, less than 4% of people have been able to get vaccinated at this point.
Really?
And they don't manufacture their own vaccines, and so like every other country that doesn't do their own, they are completely dependent on the goodwill of people producing it to sell them vaccines. And so, I'm not here to make national policy, but we certainly need to be very, very aware that prevention elsewhere means that we're safer at home. Because you're right, it is a completely global world at this point.
Thank you.
And then I just want to close with how well we are doing as a county and how much worse things could have been. So statewide, there have been 9,022 deaths in Maryland. We are 1.5% of Maryland's population. So if our fatalities resulting from COVID had been proportional to the state, we would have expected that 135 people in Calvert County to this point would have died. We've seen 70 deaths. Now, certainly tragedies for those people, their families, but we have prevented 65 deaths, even if we were at average, much less if we were worse than average. So almost a 50% reduction. And hospitalizations, and I think one of the stories that we'll see into the next year is the number of people with residual health problems as a result of their COVID infections. And I'm not going to touch too much on myocarditis today unless you want to, but certainly we've seen just thousands and thousands of cases of myocarditis because of COVID. We've seen people are going to have compromised respiratory systems, people with strokes and all sorts of other blood clots as a result. So we would have expected 646 hospitalizations based on state averages, and I love the math here. We've actually had 323 people hospitalized. That is exactly a 50-50 split. So we have prevented half of the number of hospitalizations that could have or would have occurred without taking all the measures that we collectively have. So I just listed some here, which I think are worth noting. The single most important, these are roughly chronological order, but I think the single most important thing is the partnership between the health department nurses and our local nursing home administrators and staff. That we essentially, as much as we could, put a virtual bubble wrap around our nursing homes. And we ended up with one true outbreak in a nursing home, and unfortunately the timing was the month before the vaccines became available. But we saw across other parts of the state and across the country just how horrible things were in many nursing homes. Private practices jumped on board very quickly. I think that Dr. Johnny and Dr. Maida's practice and Calvert Internal were probably two of the first practices in the entire state who started doing COVID testing on their own patients, and then other practices adopted that pretty quickly. That also, I think one of the big sort of philosophies here locally was that COVID testing should not be divorced from people's overall health care. It was a critical time to give people advice on things, to reinforce the importance of isolating when somebody was sick. And it was really driven home over last spring and early summer that we knew the winter was going to be bad, and that people with underlying health conditions, diabetes, high blood pressure, people who were significantly overweight, and you can go on with the list, kidney problems, that they had about 3 or 4 months to try to get their health improved, to that if they got COVID over the winter, they were less likely to become seriously ill or die. And then we saw, as the evidence for face masks started coming up in April, that both residents and businesses adopted face coverings quickly. And when I was out and about, I saw that almost everybody really was doing their part. And another, I think, core tenet is that we are here not just for our own well-being, but we are here to also try to help our neighbors, especially those who are most vulnerable. I can't speak enough about the emergency room and ICU staff at our local hospital under extraordinarily trying conditions, especially in the first few months. We quickly forget how just basic things like gowns and and proper N95 masks were in such short supply, and they were literally putting their health and their lives at risk. And then dedicated contact tracing 7 days a week to make sure that people could take the steps to, again, protect their neighbors, protect their family members. I mentioned outreach from African American leadership. It wasn't just with vaccines, but other measures as well to help keep people safe. And then our county Office of Aging, working with the nurses from the hospital to go out and do vaccinations at locations where seniors live in the community to make sure that they didn't have to drive anywhere to get their vaccines. The health department nurses jumped back in when we saw CVS and Walgreens faltering in nursing home vaccinations. And that partnership that we had established many months before, we were able to just almost instantly go in and get people vaccinated. And then all the staff at the drive-through that have just, I think, done a great job regardless of what the weather was when it was cold and, sub-freezing days and they're out there. And I think I've yet to hear really bad experiences from people out there. We just wish we all along had more vaccines early on. So again, just, everybody throughout the county doing a tremendous job. And then just to remind everyone that we do have vaccines available, anyone 12 and over, and you can register directly. And then we are running vaccine clinics at the drive-through 4 to 5 days a week. And many people's family doctors now have vaccines available for them.
Well, Doc, hopefully, America's famous for short-term memory loss.
Yeah.
You get through and go, oh, we're good.
Right.
To whatever the next thing is. And, I beat on it all the time. To put some money in prevention, starting at the school level. New York City should not have to get on TV and say they don't have machines, the ventilators and all that kind of stuff. I mean, we spend billions and billions of dollars on other things, but we always forget infrastructure, always forget the healthcare system. If you're not healthy, what does it matter? I mean, take the most rich guy in the world and trade it all, to be healthy again. But, we'll see when talks start in Annapolis again in January if all of a sudden it's all forgotten, right? It was the big thing, but we'll hopefully a lesson comes out of it.
And I very much hope you're right. And, health is the most important thing, but we can't forget that money is always part of the equation. And sometimes people forget that we pay way more for healthcare per person in this country than any other country in the world, and we're not healthier than a lot of other countries in the world. And that's because there's more preventative efforts other places than there are in the U.S. So I am hoping that maybe one of the things that comes out of this is, as you said, a shift to more preventative.
And I hate saying it, and I ain't gonna get on one of those soapboxes. When I was a kid, you didn't go for 9,000 different tests, right? You see it now. I mean, you see it's a test for this, test for this. Can't get information from one office to another office. All this costs money when everybody touches it, And all the time you see now on TV, if you take this medicine, well, you're not cured, but your levels are so low, they're undetectable and all that. Why? And I hate being a conspiracy guy. If you can do all this stuff, why not just cure it? If you can take it down to such a, you know what I mean? I hate being a conspiracy guy saying that. I always say it seems like sometimes the money is in the treatment, not in the cure, right? And I hate being like, because, if all of a sudden you cure it, there's no more money. And I hate saying it, so that's why I go back to your immune system and healthy practices is the only thing you can control. I just really wish they would focus a little more on that and starting at the school age, just good practices. I
Absolutely.
mean, spending all the money, after the horse is already out of the stable, been a whole lot cheaper just to build a better fence.
Right.
So, Doc, they're talking about a booster, and I don't know if you have information that we don't, but I would anticipate that won't be a 2-dose booster.
No, at this point, I have not seen any evidence that the vaccines are wearing off. And so, again, I think that when the term booster, I've heard it used, I think it's used in a kind of a sloppy way, that I think a lot of times people are referring to what I would consider a supplemental dose for a variant. And to me, a booster is you're giving the exact same thing to literally boost up immunity. I'm not aware of, again, of any evidence that people who've gotten vaccinated at this point, and the initial trials were back last July, so we're getting closer to a full year from the first people. I'm not aware of any evidence that those people, we've seen any increase in infection risk for them. My sense is, and again, this is purely just based on just general immune system and virology background and how other vaccines have worked and how coronaviruses in general are treated by our immune system. If I had to put my money down, it would be somewhere between 2 to 5 years that I would expect, at least for the Pfizer and Moderna, given that they do have a booster built in, that 2 dose. The Johnson & Johnson, I expect, will wear off a little bit earlier because it did not have that initial booster dose.
And you currently have all 3 vaccines?
Correct.
On hand. And if somebody wants a shot, all they have to do is register and pick a time.
Absolutely. And so we do, the bulk of our vaccinations right now are either Pfizer because they're more flexible. We can vaccinate at any age 12 and up, and Moderna. So do take a look, and we try to emphasize when people register that it says Moderna clinic or it says Pfizer clinic, and we're alternating. So this week we have 2 Pfizer clinics and 2 Moderna clinics. So if people have a preference, or if someone already had their first dose of Moderna, then we want to make sure they have an opportunity to come back for their second dose as well. The Johnson & Johnson, because it's a one-time, and we don't have that, the potential to intermingle.
So Commissioner Hutchins sort of alluded to, but I assume that in some point in the future, the vaccination site on 231 is probably going to be removed. There just won't be enough volume to justify the manpower that it takes to run that.
Right, and we've had some discussions about that, and we don't have a set answer because, again, we don't know what demand will be, and again, there's just been so many unpredictable twists and turns through this that I will say it's likely that we will run it through the summer, and at that point, because I want to make sure, and one of the things that one of the groups I think that we have to keep in mind is for college students who don't always have a personal physician, they sort of outgrown their pediatrician, and they may not have a family doctor yet, although I would encourage them to do that. But there are a lot of colleges, both in Maryland and out of state, that are going to that have already announced that they're requiring vaccines to go on campus. So my expectation is, and they'll need to be fully vaccinated. So my expectation is July into August, that at least for that group, we'll probably see a bit of an increase in demand, sort of like a lot of things people wait till last minute. But my hope is that by that point, most of our primary cares have already started vaccinating, that at that point, all of them will have started making the vaccine available. There'll
be a transition into a different location to get your vaccine. That's why I asked last week about the number of first doses, because that's the indication of, those 600 people are going to need their second dose in 2 or 3 weeks. And, it's going to trickle down where, we...
In this past week, there were about 2,500 Calvert residents who got vaccinated. And of course, there was a boost because that 12 to 15-year-old age range became eligible for the first time. But we're still seeing a good number of people who vaccines had been available previously and are now becoming more comfortable, or for whatever personal reason have decided to move ahead. Maybe they know somebody who developed COVID and had a serious illness, but whatever their motivation is fine. So yes, I expect that a mass vaccination site or a community vaccination site will be unlikely by the time we reach the fall.
And I don't know if anyone else has, but it's the only government operation I haven't received one complaint about, is the actual physical operation of getting your shot on 231. Yeah. Everybody that does that, once they do that, say it was pretty amazing. Staff has been outstanding and seamless. And
health professionals take their jobs incredibly seriously, and it has been, what I've emphasized from the beginning is that people should receive the same level of care at our county health department vaccination site as they would expect to receive at their family doctors. This is still part of their health care. That means getting questions answered, taking time to do things right, and certainly from there's no room for error for things like this.
Yep. They were all very friendly, at least in my experience. No one had a bad day. So it was a very good operation.
Great.
So,
well, thank you.
Yeah. Any other questions?
Just a quick comment. You pretty much robbed me of what I was going to say.
I'm sorry.
That's okay. In the sense of, zero complaints and laudatory remarks. I mean, job well done.
Just imagine if you could get your shot and pick up your permit at the same time.
Or get your driver's license renewed. Not to pick on a particular state agency,
Right,
but
right. Yeah.
but everybody commended the operation down there and how great it was. So
Thank you very much, and I'll certainly relay that to our staff.
Yeah, trust me,
Yeah.
if you weren't doing a good job, we would be getting emails. You
yeah,
know?
I-
Yeah.
because they don't normally call to compliment; they usually call to complain.
Right.
So when they compliment, you know that things went really well.
And
so
And I've gotten some handwritten thank
Yeah.
you letters
Yeah.
from people, which we certainly appreciate. Any good feedback, whether it's phone call, whether it's an email, but there is something a bit nostalgic to see that people actually took the time to get some stationery out and write some things.
So as Commissioner Hart alluded to, it'll be interesting to see how many of these practices continue on as far as washing your hands and wearing a mask, because we saw 0 cases of flu and everybody says it's because of the sanitary actions that we took. So it'll be interesting to see if next winter people remember that and practice that a little more often and see how that affects our flu cases.
And we were having a little discussion over the weekend amongst a large group of the physicians, nurse practitioners in the county, and that was one of the things that was brought up is, in both the medical offices and their recommendations from doctors to their patients when we start to get toward flu season as to how those messages will be conveyed. And certainly it's very unlikely there will be anything mandatory, but if people see the value for themselves and for others.
Right, and if all those hand sanitizing stations actually stay up and operational, that'll also help people take the action. So it'll be interesting.
Yeah.
So, well, thank you very much, Dr.
Thank you.
Polsky.
Yeah.
Thank you all.